There are certain medications that you want to be especially cautious when entering them into the system. These medications include meds with different releases, meds with different routes, meds with specific dosing schedules, inhalers, methadone, PRN meds, and insulin U500. Let's briefly discuss the first two categories. Some medications have multiple release formulations. Examples include diltiazem, bupropion, venlafaxine, metoprolol, and verapamil. Be careful to select the correct drug. If in doubt, do not select a formulation. Instead, enter the drug as a miscellaneous medication and add in the special instructions where the patient has the prescription filled at. In the compliance section, select Investigating from the drop-down options so the pharmacy staff can follow up. Many medications can be dispensed for different routes. Be sure to obtain how the patient takes each medication. Medications such as nitroglycerin are commonly prescribed to take either sublingually by using a transdermal patch or through using a nasal spray. Of note, the system default route does not always match the route the patient uses. Be sure to update the route as needed. Some medications may require the patient to adhere to a specific dosing schedule. This can be seen for patients taking warfarin. For example, the patient states that they take 2 milligrams of warfarin daily on Mondays, Wednesdays, and Fridays. Then, they take 3 milligrams daily the rest of the week. You will need to chart this by entering in separate medication entries for each dose and then selecting the appropriate days using the predefined frequency options. It is important to use the frequency selections that correlate to the days of the week they take each dose in order for the system to correctly convert the medication schedule during their stay. If needed, multiple orders for the same dose can be entered to cover all of the days using the pre-built frequencies. Let's look at another example for a medication that the patient states they take once a week, such as methotrexate. Instead of using the frequency of Q week, select the day of the week the patient takes the medication, such as every Friday, from the drop-down options instead. If the patient uses an inhaler but is unsure of the name, you can use the Inhaler's Job Aid in Learning Live for the patient to identify which inhaler they use. It is extremely important to document the correct concentration of the medication for respiratory medications. If the patient is unsure of what dose they use, select the drug name without the amounts listed. If the patient does know the dose, be sure to select the correct concentration from the list options. For any nebulized breathing treatment, remember to change the route to neb. For patients taking methadone, type in the location of where they get the methadone from. The pharmacy staff will then contact that facility to gather the current dose and the date the medication was last given to the patient. In the compliance section, select Investigating from the drop-down options. For PRN medications, you would again enter in the drug details as previously instructed. However, you will need to select the PRN reason from the menu options in order for the system to convert this correctly to a PRN order. You can include additional details such as how often the patient needs to take this medication in the comments field of the compliance section. Lastly, we will cover how to document U500 insulin. When charting U500 insulin, be sure to select the correct type. Do not enter anything in the dosing field. All medication details will be charted using the Special Instructions section. Enter in the type of syringe the patient uses, whether it's an insulin or TB syringe, and the volume amount the patient draws up. Verify what you entered with the patient. In the Compliance section, select the Investigating option from the drop-down menu. A pharmacist will meet with the patient in follow-up and verify the dosing information. The pharmacist is responsible for verifying all information with the patient and entering the dose in the dose field. For additional information regarding how to chart U500 insulin, you can refer to the job aid in Learning Live. This may also be found in the Resources tab if viewing this video in a training module. Although each patient encounter is unique, there are a few scenarios to discuss in more detail. Up next, special patient situations.